limbs on the department's latest four-dimensional colour ultrasound equipment. Staff work closely with patients to prepare an antenatal program based on a client's specific needs. The program has been designed as an affordable package to encourage clients to participate in all the hospital visits, ultrasounds and education. The nursing staff are always happy to show clients the hospital's excellent facilities, especially for mothers-to-be. In total, there are 7 private labour and delivery rooms, each fitted with modern equipment and specially adapted beds. There is also an operating theatre dedicated to caesarean section cases. It is always stressful for a parent when a baby is unexpectedly admitted to the neonatal intensive care unit. There are 14 incubators in the NICU, each specially designed and equipped to care for the most vulnerable babies. There are also 8 special care baby units for premature babies. The nursing staff supports the family throughout their baby's stay. Both the nursery and the neonatal departments are totally secure. They are monitored round the clock by supervisory staff and a closed-circuit TV network in accordance with strict guidelines.
The pillar of any family is the mother, and of course the father. So the hospital serves the needs of the whole family, and especially obstetrics and gynecology and pediatrics. Our young clients are very important to our hearts.
Families who have difficulties concerning conception are able to seek professional advice and treatments such as IVF and ICSI from the hospital's experienced staff in the IVF clinic. The Coronary Intensive Care Unit, or CCU, specialises in the care of patients with heart attacks, unstable angina, cardiac dysrhythmia, and various other cardiac conditions that require continuous monitoring and treatment. This patient is undergoing an ECG stress test. His symptoms and blood pressure response are repeatedly checked by the consultant. The Al-Mashari Hospital is one of the few hospitals to carry out echocardiograms using ultrasonic waves for continuous heart chamber and blood movement visualization.
Sir, please don't take a bath and...
In some cases, a Holter monitor can be provided to continuously monitor the electrical activity of the heart for 24 hours. The hospital's doors are open to everyone, day and night. And whether it's a road traffic accident, heart attack, or other trauma, the hospital's emergency department springs into action. This ambulance is a mobile ICU unit and is one of 3 ambulances working 24/7. This patient has been in a car accident and is unconscious. The emergency department has 3 fully equipped emergency rooms and 7 observation beds, as well as an operating theatre for immediate surgical requirements. The patient is having difficulty breathing, and the doctor decides to intubate him and to ventilate him with an ambu bag.
X-ray step, please, يلا. Connect the lead. Insert the IV.
He is then connected to a portable ventilator and sent for a complete radiological checkup to rule out any life-threatening injuries. Computerized tomography, or CT scan, uses X-ray equipment and computer software to create pictures and slices of the inside of the patient's body. The radiographer operates the scanner from the control room. Conscious patients are able to hear and speak to the radiographer during the procedure. The scans are then analysed and recommendations made. In this case, further investigation is required, and an MRI scan is performed to provide a more accurate diagnosis. This state-of-the-art open MRI scanner is much more comfortable for patients than the older tunnel scanner. MRI scans are much more effective than X-rays for imaging soft tissue and creating cross-sectional and three-dimensional pictures. Often the diagnosis necessitates surgery, and the Al-Mishari Hospital provides some of the best surgeons in the kingdom. This patient has a prolapsed disc.
The surgeon pinpoints the correct disc on the MRI image and then begins the surgical procedure.
Slowly and painstakingly, the surgeon exposes the damaged spine and removes part of the disc that is pressing on the nerve. Strict infection control is absolutely vital in the operating theatre. Designated areas for clean surgical instruments ensure the strictest levels of hygiene and infection control. Dirty surgical instruments and other equipment must be properly cleaned, disinfected and sterilised in the central sterile supply department. Inside this controlled area, the clean instruments are inspected for quality to ensure good working condition. The process of carefully sorting and packing the sterilised instruments is carried out meticulously. The CSSD staff members are well trained and skilled. Everything they do has a direct impact on infection control, patient care and safety. The sterilised packages are then dispatched by a clean lift to the point of care. The recovery process for spinal injury patients can be time-consuming, and relearning how to walk is often a slow and frustrating experience. The physiotherapy department's specially designed rehabilitation programs for both adults and children aid recovery, especially for trauma or congenital injuries.
Open your eyes.
The neuroscience department analyses and treats problems associated with the central nervous system. An electroencephalograph, or EEG, measures This occurs where there is evidence of a trapped nerve, such as carpal tunnel syndrome. As the nursing staff prepare for a busy afternoon shift in the urology department, patients are being readied for dialysis. The The hospital's dialysis unit consists of 10 beds for routine dialysis cases and a diagnostic service for patients with acute renal failure requiring dialysis or hemofiltration.